You're listening to The RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Hello, and welcome to another episode of the RN Mentor podcast. I have the great pleasure of being joined today by Robin Cogan. Robin is a nationally certified school nurse, currently in her 20th year as a New Jersey school nurse in the Camden City School District. Robin is a legislative co-chair for the New Jersey State School Nurses Association. She is a Johnson & Johnson School Health Leadership Fellow and past program mentor. Robin is the honored recipient of multiple awards for her work in school nursing and population health. These awards include the 2019 and 2020 National Association of School Nurses President's Award, the 2018 NCSN School Nurse of the Year, 2017 Johnson & Johnson School Nurse of the Year, and the New Jersey Department of Health 2017 Population Health Hero Award. Robin serves as faculty in the School Nurse Certified Program at Rutgers University Camden School of Nursing, where she teaches the next generation of school nurses. She was presented the 2018 Rutgers University Camden Chancellor's Teaching Excellence Award for part-time faculty. Robin writes a weekly blog, The Relentless School Nurse. She also has a monthly column in The American Nurse, the official journal of the American Nurses Association. Robin was recently quoted in the New York Times and interviewed on CNN and other media outlets on her expertise and experience as a school nurse and the safety of schools reopening during the COVID-19 pandemic. So welcome to this show, Robin.
Thank you. I've been looking forward to this for weeks. I'm so excited to be here.
Thank you. The honor is completely mine. After the whole thing with CNN and everything, I wasn't sure if I was going to be able to get you on the show, celebrity status.
Yeah. Oh my God.
But thank you. Thank you for being here. And I have to let all of our viewers or our listeners know, we strategically planned you being on around this time, specifically because schools, some of them are opening up, some of them are not. And I know you have a wealth of information to share. But before we get into all that, I really want to kind of start with your nursing career, how you got started in nursing. And then I want to know, how did you get into school nursing? Because that's not a specialty people really get into until, they something happens, right? So it's not, some people usually don't come into nursing saying, I want to be a school nurse. So how did that happen? And how did you get started in the world of nursing?
So first, I have to say that the name of your podcast, right? The Mentor Podcast.
Yes.
Is nothing that I did in my nursing career. It was the complete opposite. And I only wonder, truthfully, if I had a mentor earlier in my career, things might have gone very differently for me. So I really want to frame it by saying, as much as I love what I've done in my career, I had no guidance. I had no roadmap. I made decisions on a whim. I did not start out to be a nurse. As much as I'm the relentless school nurse, I'm also the reluctant nurse because that was not my first career. I actually studied art therapy. And when I was in my art therapy program, so I love your art, by the way, that really touches me on the soul level. I was studying psychology and art therapy. And the reason I went into nursing, it's a very long story, but to make it, it's a pretty compelling story, actually. I was studying art therapy My family's background, I'm not sure if you know, but we've had a history of horrendous generational gun violence in my family. And my father lost his entire family and 10 other neighbors in one of the first mass shootings in the United States.
Wow.
In the same city where I happen to work. So all these things, come back in a big circle. So I was studying art therapy. This happened when my father was 12. So he was an orphan at 12 and left the city of Camden, where I now work. And, fast forward, got married very young, had children very young. I was always interested in art, always interested in art therapy and the creative arts therapies. So I studied in the program where I was studying. I did an internship at a psychiatric hospital, not knowing that the killer of my father's family was an inpatient there.
Wow.
I never met him or saw him there, but he was there. I didn't even know he was still alive. It was one of those things in 1949 when this happened. These were secrets that families kept pretty much. So anyway, in the early 80s, when I was studying my art therapy program, a public defender in Camden County took on the killer's case because he had never been given a trial. And he was able to get all of the murder indictments dropped against the murderer. And in the course of the trial that happened through this process, the art therapist that was my mentor at the facility testified on his behalf.
Oh, wow.
And simultaneously, I was finishing up my program and I was doing a clinical in a general hospital, but a psych unit of a general hospital. So there were two things happening at once. The art therapist that I had so much respect for was testifying on behalf of the killer of my father's family. And there was a group of nursing students coming through our psych unit, and one of their classmates was an inpatient on our unit. So like all these worlds were colliding for me. And I realized I was missing a lot of information clinically about the mind-body connection. And at the same time, I wasn't trusting what I was studying, because how could it be used in support of someone who had done so much damage to my family? So without very much thought, I decided to go to nursing school. So I finished my program, I got my degree, and I turned around after my 4 years of my undergrad, and I went to a 3-year nursing ADM program. It was the early 80s. There was no such thing as an RN completion program, a BSN completion program. They didn't even exist. That's when BSNs were relatively new back in the 80s. There was many more 3-year programs or 2-year programs than BSN programs. And even though they wanted that to be the entry level, obviously it wasn't and still isn't. Right. So anyway, that's how I became a nurse. So that's why, on one hand, I do consider myself sometimes a reluctant nurse, because it happened in a very haphazard way. But I have to say that what I learned, what I experienced, the tools that I had through my art therapy work and my psych background helped me tremendously as a school nurse. Tremendously.
It's a little bit amazing, because a lot of people I interview, some of them say, nursing was their thing from when they were a child, and then more than less, the people I interview kind of stumble into nursing by some event or not the first plan, and it wasn't mine either. I had a military career, sort of, about 10 years of military life before I went into the world of nursing. So it's interesting that you transitioned from an art background into nursing. Actually, it's one of those things. I actually have quite a few students in the accelerated programs that I see that have like a more of a art background or music background, and then they transition into nursing. So maybe there's a connection there.
Yeah, that's interesting. Maybe there is.
So how did so once you went into the world of nursing, you went through the nursing program. What was your transition into the nursing career? Because
so my focus was psych, always psych and drug and alcohol rehab. That's where my passion was. When we went, I remember doing our psych clinical. I was the only one that was just loving every second of it. If you put me in the ICU, I might stand in the corner and cry. But put me in the psych unit and I'm good. I'm talking to people. I'm, running groups. I'm feeling really in my place. So that's where I really started my career. I worked for a psychiatric facility that was part of Princeton Hospital. And I soon got into, this is what I mean, it was very aimless. I soon got into case management. Which I found really, really interesting. I eventually worked for a railroad, actually, and I did occupational health.
Oh, wow.
And that was really fun. I loved the job. I was the health service manager for the Philadelphia division of Conrail, and for about 5 years. But Conrail had a hostile takeover by another railroad. So I could have either moved our whole family. By that time, we had our kids and we were entrenched in the area, and nobody was going to up and move with me to Jacksonville, Florida. So my kids wanted to go to overnight camp, and I had a bit of a sabbatical, you could say. There was, a little bit of severance. And that summer we went to overnight camp, and everybody there was a school nurse.
Oh, wow.
So just like all my other decisions in nursing, I said, maybe I'll be a school nurse. And that fall, in New Jersey, you have to be certified just like a teacher through the Department of Education. So I signed up for coursework immediately. As soon as I kind of make a decision and I go for it, right? So the very first night of my very first class, the teacher said, if you're able to work now, Camden City is hiring through an emergency certificate. So I called them the next day. This was early September 2001. And they called me for my interview on September 12th, 2001. So the day after September 11th. And I remember thinking, why are they calling me? Like, the world's coming to an end. There's no need to, what's going on here? I was in such a, you remember that, although this is so much different. Anyway, I went for my interview and they hired me immediately. So I have been there since, this is the beginning of my 20th school year.
Wow, that's amazing.
Yeah, yeah.
So that's a huge change from what we normally see, like people transitioning through their careers, especially school nursing. I had my university, the college, the nursing department within the college and university are putting together a program, and I had a chance to, I actually reached out to you a while back, and we talked briefly about what should a program look like, a school nurse program look like, and you were very helpful with that. But it was strange for me to look at a school nurse program, because it's not, the stuff that's in there is a lot of the items that we kind of cover in a nursing program, but there's kind of sort of brushed over or nothing in depth, and it is its own really specialty,
yeah,
right? There's a lot that goes into it, and it's the whole family unit, it's the community, it's the environment, it's a little bit of everything, right?
It's really population health and very individual. It's really like you have to be able to do both at the same time, because things happen that way.
Yeah,
Yeah.
and most people don't think about school nursing in that capacity because they think, oh, you kids have like a bloody nose, or they scrape their knee, or they have they have a temperature. It like that's kind of the mental map. But when I was looking into it, I'm like, oh my god, there's so much I didn't even think about that school nurses do, and it really is its own specialty and should be definitely recognized as such.
And truthfully, we have a national certification that supports that
Right,
specialty
right,
practice. We also have our own evidence-based framework for 21st century school nursing practice based on 5 principles of school nursing. And so, yeah, I mean, it really has been elevated, I would say, especially in the last 10 years, the importance of school nursing. And I think COVID has really shined a light on what happens when you don't have a school nurse, and the urgency of having school nurses, and how 25% of this country, schools in this country, don't have any school nurse.
yeah,
Um,
absolutely. And Los Angeles has been guilty of that. We don't have school nurses, and actually, the teachers went on strike a couple of years ago. And one of the things that came out of that strike was a school nurse at every facility.
and one of the reasons was because there was a school shooting and there was no school nurse on duty. I remember watching intently with the interview, the heart-wrenching interview with the staff that was trying to aid the student that was shot. And
Right.
that was, I mean, Chicago went on strike about not enough school nurses. Oklahoma, I believe, went on strike about not enough school nurses. So, I'm really encouraged to see, not that we want to go on strike, but I'm encouraged to see actions taken around at least spotlighting the importance of having a school nurse in your building. And it can't be more important than right now. It just
Right.
can't.
Right, and that was one of the major things. Like I can't imagine not having a school nurse. Not that teachers aren't capable of taking care of the children, but it is another specialty. It is a very specific thing, and not having a school nurse that's going to be able to address the
And
health
who's going
and
to assess the kids? I mean,
exactly
who's doing that actual assessment, right?
right,
And
right,
who knows the community resources? Who understands the contact tracing that we're going to need? Um, and who can? Not that teachers can't talk to parents; they absolutely can. But when you're talking about your child's health and well-being and welfare, it's a different conversation that a teacher would have than a nurse would have.
right. And you really do need that nursing and medical terminology and understanding of how the healthcare system works as a whole. Because one of the things I was reading is how school nurses actually help family navigate the healthcare system, which
Absolutely.
is something I never thought about the school nurse doing. But absolutely, I mean, why not? I mean, that would be the most appropriate individual that we can look at
Oh, that happens
as a resource.
so often in school nursing. I had a mom who she came from a part of Guatemala where they speak a Mayan dialect, like an ancient Mayan dialect. So even Spanish for her was a second language.
Wow.
And she had a medical emergency. To make a long story short, she brought back her paperwork from her medical emergency. She submitted it to her employer, and her employer said it was fraudulent and he fired her. So she brought the paperwork to me as the school nurse. Now, is she my client, patient, person? I think so, because I care for her son. And if you look upstream, if you don't help mom, what's going to happen to her child, right? So I did some digging, and mom was seen at a clinic for her discharge work. The clinic, the nurse practitioner at the clinic had taken a medical leave. And so what they did was they slapped on a bunch of stickers with the wrong phone number on them on prescription pads. So her return to work note was handwritten, no date, and the phone number was wrong. So it did look fraudulent. The good news is I was able to connect the provider to the employer because he was a little on the extra mean side, and he wasn't even taking it. He wasn't taking my word. And so it all worked out, but it was about 2 hours of really kind of digging in and waiting. And I mean, I was having a hard time navigating this. Mom, we have to meet people where they are, right?
Right.
We can't
Right.
just cast people off. We have to meet people where they are. So anyway, that was a good news story. She got her job back. And, if you look at what could have happened, it could have been a terrible situation.
Absolutely. Yeah. So like I mentioned, I never realized how involved school nursing was till I had to look into it because I was writing course proposals for the different variations of stuff and looking at certifications and national certifications and things like that, looking at those to kind of guide me. Now, I want to hear more about your school nurse stories, but before we get into that, how has your journey been overall as a school nurse? Because you've been in this arena for 20 years. Where do you think, besides what's happening in the spotlight on school nurses right now because of the coronavirus, what has been the struggles? What has been the ups and downs of school nursing?
So, on the bigger picture front, the one of the biggest challenges of school nursing is that there's nowhere to grow exponentially. There's really no system of upward mobility in school nursing. You have the same job for many, many years, decades even. Look at me, 20 years.
Right.
And it's because we are medical people within an educational setting. And aside from having, if you're lucky enough to have a school nurse in your building, doubtful that you will be reporting to a school nurse as a supervisor. Right. And so all of the supervisory positions are certified for educational staff. I could, as a school nurse, get my supervisor certificate, but it's not a health services supervisor certificate. It's a curriculum certificate. It's a general educational supervisor certificate. So it's not specific to health services or to school nursing.
Right.
And that has been a deep source of frustration for me. Over the last 20 years, if there were nursing supervisors, but they retired, those positions folded and they never replaced them. So in New Jersey, for example, I'm in South Jersey. So from the middle of the state down, there's really only 3 school districts that have supervisors that are school nurses. So
that's not very many.
Yeah. So what I have found is that I've learned to grow horizontally instead of vertically. And I have found ways to kind of nourish that part of my, I don't know, what is the word? Not motivation, but, my desire to learn more, my desire to do more, my desire to get involved more. And so that's what I've done. And when I told you in the beginning about not having a mentor, I really wonder where my personal career path would have gone had I had a mentor. I was always a lifelong learner. I love to learn. But if you look at someone like me who has probably, I don't know, 190 bachelor level credits, but I don't have a BSN because of the way our system is. I have a master's degree and all of that good stuff, but it limits me for some arbitrary reason of not having a separate course in community, but yet I am a school nurse so embedded in my community. Like if somebody would look at my portfolio of coursework and my portfolio of my work, maybe they would have pity on me and grant me an honorary BSN.
And actually, that's very important because I look at programs and I look at organizations and I look at and there are these barriers. Like people that it's like mind-boggling some of the individuals that aren't, for example, belonging to an organization because of that barrier, or they are unable to move forward because of that arbitrary like nursing degree Because I know it happens with like certifications, right? Like, oh, you need a BSN in blah blah blah, but you have like X amount of years in place. You have a robust portfolio. That BSN is not going to get you anything other than make your pocketbook a little bit lighter, right? So you have a nursing degree, you have degrees in other stuff. Because this happened with a colleague of mine when I was at the hospital. A she had an ADN, but she got her bachelor's and master's in other fields. But she had to go back and get a BSN for a promotion because she didn't have the minimum requirement was a BSN. I'm like, yeah, but she's got like 30 years in nursing. I mean, that BSN is not going to give her anything more. It's not going to enrich her any more than what she's done already in her like career. So it's like those are very that's a really interesting point. And one of the things I always tell my students or anybody who's asking me, I'm like, this is why it's important to have a portfolio of your work, right? Because so many people don't have, people have moved into this online fill in the blank job resumes and that's all they're doing. But portfolios really allow you to showcase what you have done in your career. And when you're talking about, growing horizontally, that's what a portfolio really allows you to showcase is look at everything I've done. Yes, I'm in this position that is not allowing me to move upward from a title perspective, right? But you can easily showcase how much you have done because not everything happens at your job. So that's a really important point, and thank you for bringing that up. So moving forward, and I definitely want to pick your brain about this. We are in the middle of a pandemic, and I know you've been on several programs already, and you have blogged about it. So how did you what do you think about what's going on with, well, I know what you think, but I want my listeners to to hear it also. What do you think about what's going on with the coronavirus, with the children and teachers and administrators and staff being back at schools in some cities around the country? What's your thoughts about that?
I'm very discouraged that we never had a national response to this pandemic. When we look at other countries and we compare ourselves, it is embarrassing that we as a country, based on the highest levels of this government, decided to either pretend that this was not serious, not follow the science, degrade the science, and minimize the death and the despair that's happened. So what I see happening now is we are in a place that we never had to be. When we closed the school buildings in March, things were much better than they are right now, and they were scary in March. So when I look at opening schools, and I've been very entrenched in it both at the state level and at the local level, it feels to me like we are doing the biggest social experiment ever without an IRB. Because we know that our kids have been bubble wrapped for the last 5 months. They have not been together with other kids. They did not go to summer camp. They did not do the activities that they would normally do. They might have done, hopefully, some social distancing. I granted there are kids that didn't follow all of that. But we don't know the impact of the spreading of the what's going to happen when we are all together. We have a little glimpse of it in other countries. Israel opened way too soon, and they're even saying, don't watch what we did because we didn't do it right, right? The countries that did it right, they were very deliberate. They listened to their scientists. They recognized the importance of public health strategies. I mean, to tell you the truth, right now, Allie, this is all we have. We have 5 things, maybe 6. Ready? We have wear a mask, which we're not even there yet because we don't have a national standard. We don't have an agreement on masks. We have some crazy political divide on wearing masks. Wearing a mask does not infringe on your constitutional rights. It actually saves you and your friend and your neighbor and maybe your grandma. But okay. So the first W is wear a mask. There's 5 W's. The second one is watch your distance. right? The whole social distancing thing. But in my school community, if you tell somebody to stand 6 feet apart, but they speak Spanish and think in metrics, and you don't tell them 2 meters, they're not going to understand that.
Right.
Or if you have people that aren't good at visual spatial relations, tell them the refrigerator laying down. Stay as far apart as a refrigerator laying on its side. Like, we have to meet people where they are. We have to give credible messages. We don't want a social distance. We want a physical distance, but we want to stay socially connected. Like, the language is wrong. Okay, but I'll go back to my W's.
But that's a great point about social. When we first started talking about social distancing, I'm like, what? This is not the right language we should be using.
Wrong.
So I think part of the pushback was that whole verbiage. Words matter.
Words matter strongly. So tell me to physically distance. I'll get that more than social. Because social means you're going to isolate. You're going to be by yourself. That's not what we want. Okay, so I'll go back to my W's. Because, Ollie, this is all we have. This is it at school.
That is, yeah.
All right, so wash your hands. Wear a mask. Watch your distance. The other W is, when you are ill, stay home. Please don't come to school sick, staff and students. And the other W is, when the phone rings and it's the health department, answer it, talk to them, be part of this public tracing. That's the contact tracing. People are feeling very infringed upon regarding contact tracing, but I hate to tell you, unless we cooperate and participate, we are never going to get this under control. We have a very broken down public health system. So now contact tracing is part of what is happening at school. So we are not only dealing with chasing this virus and running away from this virus because we don't know who has it and doesn't have it at school, because we are not afforded the elitist testing that is being done for our athletes and the highest levels of government. Because how do we really feel about our children? I don't know. If you go by how they're being treated through this situation, I say that we're not valuing our children. How do you not value your children if you refuse to test? What are you saying about them? You know?
And that's one of the things I didn't understand is when they start coming out with pretty early on, start saying kids aren't spreading it, kids aren't catching it, their immune system is so much stronger and all this stuff. I'm like, we don't know that.
We don't know that. They're bubble wrapped for 5 months.
Yep.
And we have some examples right now. Look what happened at that camp in Georgia. We know that kids are spreaders. Right. Rutgers University football team. There's about 28 people sick right now. Yep. There, 24 lifeguards in New Jersey are sick right now from going to a party. Just look at the Phillies and the Marlins. Sorry to be so East Coast on you, but
No, it's all good. It's all good.
And there's a 6W though, and this one really gets me. The 6W is open the windows in your school, because we have this whole issue now around that it's airborne, that it lingers in the air for up to 16 hours. But I want to say schools have been told since Columbine to lock your doors and lock your windows because of school shooting. And now we are being told to open your doors and open your windows because of COVID. So really the overarching message here is school safety. We were not safe before COVID. We were having our own issues of school safety, of active shooter drills, of, special locks on the doors, of igloos in classrooms where kids could go when the school shooter would come in. I mean, rocks to throw at the person coming in your door that they were giving out in certain schools. So to me, this whole dynamic speaks to safety. Where can we feel safe? Right now, the only place I know I feel safe is inside my house, maybe with my husband, only if he's not going out somewhere and then he takes a shower and does what, but I can't even feel safe now hugging my own adult daughters because we don't live together. And, so anyway, so that's why I put together these 5 W's, but added the 6, because I think we have to really look at school safety and what that means and the impact of COVID on that.
And I think that's a conversation we haven't had. It might have happened behind closed doors. I don't think on a public level it's happened. And then the other thing that I want to talk to you about, and this is really, I don't know if you have the expertise, but as an individual I respect and want to have this conversation with, how much do you think the fact that we're unable to provide individuals from not going to work because of this, because they have children at home, right? So they have to go to work. They don't have childcare. Financially, they can't afford to, do anything or bring somebody in to live with them or whatever the case may be, to watch their children while they're at work. So how much do you think that's playing in? Because I know I have people that I'm connected to that are adamant, like, no, we're going to send our kids. They live in areas where COVID or hasn't really been that big of a issue. So they're all like adamant, like, no, send them in, send our kids because we can't not go to work. How much do you think that's playing into the push to put kids back in school?
Well, I think the big push to push kids back in school is completely political, and it's because this president, a failed president, is now facing a re-election that, he's but that's another whole story. But there may be parts of this country where it could be safe, maybe. The problem is that this is now prevalent in all parts of the country. This has spread like wildfire, and it did not have to get this way. This was not a blue state problem, as they wanted us to believe in March, right? This is across the country. This is across the world. And sadly, for us, when you look at other countries who have handled it on a national level with a national response, as if this is something we're going to work on together, they had a much better response of compliance than our country that turned every step of the way into a battle for the Second Amendment rights. And that's where we went wrong. The public health messaging was wrong. The public health professionals, the scientists, the physicians, the nurses were not respected. At the highest levels of government, scientists are not respected. We can't even trust what our own CDC is telling us. They have had to do an about face with their guidelines based on the president saying that they were too complicated and too costly. And there's a wonderful physician that I follow, Dr. Peter Hotek. He's out of Baylor University. He has something called the October Plan. And I trust him. He knows what he's talking about. This is his thing. He said, if we shut down for 8 weeks, like other countries did, and I mean no travel, nothing, like shut down. We didn't shut down. We had piecemeal shut down. And it's the piecemeal kicking it to the governors, who then kicked it to the mayors, who kicked it. Nobody wanted to make that final, really hard decision. And that's why we are where we are. If we had done what we should have done in March or February, we would not be here. Because you know what? I was a school nurse during H1N1. It was nothing like this. Now, granted, we had a vaccine in a relatively short time because it was related to another virus that they had been working on. So this is different in that regard. But in terms of flattening the curve, in terms of minimizing the cases, community spread should not be above 5% for over a period of at least 30 days before you even consider sending kids back to school. We don't have that. We don't have that. We're all over the place.
Yeah, and then there's new data that is actually talking about in communities that haven't really been affected by this, how they are actually up next as far as
they're going to be spiking.
They're going to be spiking. So that's actually concerning. And there was something else on Twitter today. I saw like a second grader, after the first day of school, tested positive, so
In
the
Georgia.
school is on. Yeah,
I saw that in Georgia. Well, there was a terrible picture of Georgia middle school, high school, first day of school. They were shoulder to shoulder, the couple people wearing masks, but other than that, it was school as usual. And that's the problem. And that governor is suing the mayor of Atlanta, who tested
yeah,
positive along with her entire family for wanting to roll back some of these precautions, put them back in place because of a spike in her city. He's suing her. I mean, that's the level of division that is happening in this country. So no wonder we are where we are, but we don't
right.
have to be here.
The national response has definitely been nothing but poor around this, and the fact that I think my biggest disappointment has been the medical professionals that have been on a national level and how they've responded to this, or how they started to respond to this, and how their messaging has continued to change depending on the political arena. So that's been the biggest
They've been
disappointment.
influenced. If Dr. Redfield is influenced by the bully pulpit of the Trump administration,
Right.
and Dr. Birx over the weekend, she told the truth. She said, this is spreading like no other. This is, all across this country. She's been chastised today by him.
Right.
But
Well, yeah,
speaking truth
that's
to power, that's what we need to do as nurses. We need to speak the truth. We need to get our voices out there and say, wait a minute, this is not safe. And that's why when I did speak to that New York Times reporter, I said, I'm just going to say it. It feels like we're playing Russian roulette with our kids and our staff. Now, I did talk to her for a half an hour, and that's the only thing she wrote. But, after I said it, she said, oh. And I thought,
right.
that's going to be the only thing she writes. And it was true. But I feel that way. I stand by it still. I feel like like I said before, we're about to have a social experiment with no IRB. And we already can predict our hypothesis. We are going to have kids and staff that are sick and, God forbid, die.
I completely, it's a sad truth, but I completely agree with you. Now, if you could have a message for parents out there, because our audience is primarily nurses that listens to the podcast, but a lot of them are parents. How would you say, if they feel helpless or if their schools are opening back up, what's the best way for them to send their kids back to school, if because they have to?
Right. So for parents, I want them to, number one, know that there's going to be a full-time school nurse at their school. I think that's an important question to ask. I think sometimes parents don't even think about it unless their child has a chronic health condition. So find out who is going to be responsible for assessing these kids. What does the isolation room look like? What is in it? How many people at once can be in this isolation room? And what is your process for contact tracing? What is the percentage? What is considered an outbreak? Is it a classroom? Is it a building? And what is the plan for when we have to go remote so that we're not taken by surprise? You want complete transparency. And I think they're going to find that schools are still deciding what they're going to do. They've probably seen more surveys than they've ever seen in their lifetime about what they were choosing to do. I also want to tell parents, you have power. Parents' voices matter. If you are concerned about something that you read in your school's plan, if you don't think it's detailed enough, if you have questions, go to that Zoom board meeting. Put your questions and your concerns in writing. Run for that school board. You are powerful. Like power to the people at this point, because guess what? It's not happening from the highest levels of government. We have to create what we want to see. And partner with your school nurse. Your school nurse is there to support you. They're there to help your child. They're not there to give you a hard time. We are just trying to follow guidelines that are shifting in sand, because as the tide comes in and something happens over here, the guidelines change. and then we have to completely, pivot. So work with us.
So thank you for that. I think that's great advice. And like I mentioned before to you, I'm lucky enough. I live in a city that is going remote for the kids, and I'm lucky enough to have the capability of supporting my kids at home with between my wife and I. Primarily my wife. I'm not going to take credit for.
Don't you dare! Don't you dare take credit for what she's doing.
And I'm lucky enough that she's a teacher. So
you're good. So
she
are
actually,
you. Hello.
Well, I can work with. I'm good with grown-ups. Kids is a whole nother specialty. I don't have the patience for it necessarily. But so. The fact that you mentioned, you're wanting the question to ask is who is the school nurse who's going to be doing the assessments? What is your, I don't want to say what is your advice? What would you say to people who are not school nurses but may feel compelled to become one or thinking about becoming one? What is your advice to them, or how would you get? Because I know most people, like when I talk to my students, they're like, "What do you want to do when you grow up?" Type of a thing. I'm still trying to figure myself out.
Me too. I'm right
like, what do you want to do? Like a lot of them go into emergency room, ICU, critical care, CRNA, all this stuff. But like, I was surprised this last semester, like somebody said, "Oh, I want to be a school nurse." I'm like, yes, thank you. Like that is a specialty, and there's definitely a need for it. So people who aren't in the school nursing arena, what would you say to those individuals kind of thinking about it or aren't sure or thinking maybe down the line they want to do something like that?
I would recommend, if they're really interested in school nursing, that they shadow a school nurse for a day. If it's their child's school or a niece or nephew's school, I think it's really important. It's a big decision to make. There's additional education needed. I think it's really important to see the real behind the scenes, where we should really have a camera with us. It would be the best reality show going. People would never be able to turn it off because they wouldn't believe it. I think that's one way to really shadow a school nurse. If you're really thinking about it, get your substitute certificate and do some subbing in a school district on some of your days off. You'll get a really good taste of what's going on as a sub. I think those are two important ways. Check out the National Association of School Nurses website, because you don't have to be a member, but they have lots of great resources. We have two peer-reviewed journals that come out quarterly, and there's some great online listservs, community conversations that you can look at to see what's happening in the world of school nursing. So those are just some ideas before you step into it. You may, if you're interested in the coursework, you may want to see if you can, shadow a couple classes and see what's happening in terms of the educational piece. Because it is a commitment. It's a time commitment. It's a financial commitment. You don't want to go through a full certification and find out, no, that was not for me. And you have to have a real, besides love of children, an understanding of pediatrics and also a real understanding of public health. It's truly a combination of community health nursing, public health nursing, major pediatrics, but also anybody who comes in that building potentially could need you, whether it's staff, visitors. You are as I tell my students, the chief wellness officer of your building. Even Absolutely. If you don't have that title, that's what you are.
Thank you for sharing that. Before, I want to be cognizant of your time. Before we end this, thank you for all the advice. This has been fantastic. Before we go, anything else you want to share with our audience?
Yeah, so I would love to encourage nurses, school nurses, anyone who's listening, if you're in nursing, use your voice. Be out there. Be active on social media. I would love to follow me on Twitter at Robin Cogan, and please visit my blog, The Relentless School Nurse. I often host guest blogs for other nurses I've guest blogged for other parents, it's kind of like across all sectors. So yeah, I would love to connect and love to see you on social media.
Fantastic. Thank you very much. And just for our audience, I will have the links to your blog, your Twitter account, your social media account on my website. So
I must owe you some things to send you then.
No, I have it.
You
I
have
have
everything?
it.
Okay, great.
I have it. I'm good. So thank you for that, and thank you for your time. We have been listening and to my very incredible guest, Robin Cogan, the Relentless School Nurse. And I want to thank you again for being here and appreciate your time. And this has been another episode of the RN Mentor podcast. You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources, and don't forget to subscribe. Until next time, I wish you fair winds and following seas.